Hello, I'm Eric Lipson with the Haiti Nursing Foundation. We're here today with Monique Germain of the FSIL School of Nursing in Léogâne, Haiti.
Hello, everybody. My name is Monique Germain, and I live in Chicago, and I'm a member of HNF, and I've been a member of HNF since the early 2000s. I'm Haitian American. I was born and raised in Haiti, did all my schooling in Haiti, and came here when I was very young in my early 20s to study, and I ended up staying here. I earned a degree in nursing. I have my master's in nursing, and I'm working on my doctorate in education, and specifically in international education. And I love what I do at HNF. I was asked, by sheer coincidence, I met a colleague of mine, J.C. Colin, at a conference, and who asked me to join in HNF board because I had a Haitian background, and because I was a nurse, and because I was teaching in nursing. She thought that I could really help out, which I did. I volunteered to work, and I started going to Haiti to help out with the school. And ever since then, I never stopped. And why? I don't know. Sometimes I ask myself, but I find myself wanting to do more every time I go, because the students are just exactly what you need to keep you going. When you go to a graduation class and you see everybody graduating, making it after 3-4 years of hard work, and with the support of everybody from HNF, it gives you the push to keep wanting to do more. It's not easy. Sometimes there are events that you cannot control, such as the earthquake, such as the disturbances that are in the country. And then you say, oops, that's enough, I'm not going. And then you find yourself going again. You want to help because you remember all the hard work that you did. You just cannot let that wash away, and you want to continue and help.
So you and Jesse just sort of met by accident at that meeting?
Just by accident. Just by accident. I guess the Lord wanted it. And then she asked me, and I guess she was looking for people who are in education. And I so happened to have been in education, and it worked out very well.
And you just met her at that conference?
Mm-hmm.
That's networking.
Yeah. It's been a long time, in the early 2000s. So when I said, sure. So I started going, and I kind of liked it, and I kept on saying and helping, and every class, it gets better. It wasn't easy. I think my big contribution that I feel is when they had the earthquake in, 2010? And happened in January. And of course, Hilda was all by herself. And I wanted to go. So in March, they said you could go. So I went. I kind of as a first responder. And Hilda had none but tents in the yard, because everything was out, and then it became like ground zero. So to help out, I remember working 8, 10, 16 hours a day right there on the plants with the students, because the students were actually giving help. And there were a lot of organizations, that the students were helping, because they didn't have class, but they helped out because they were being ground zero. You had all the NGOs that was there where they were, and we actually had a makeshift hospital there. It was set up as ground zero period. Number one, because that was the only place that remained standing. Everything was destroyed all around, everything was destroyed, and PowerPoints was nothing. So all the NGOs, their place was, the campus became their place. their lodging, their hospital, and everything. And you know, we're right at the by the sea, so things were coming either by ship or by helicopter, delivered to the military ground or to us and supplied to us. So, and then we had our own makeshift hospital. So we did, man, I saw so much. We did so much. And that's when you know, because you really had to use your skills to do things that you've never done before and apply it.
The nursing school had some damage, but it was still standing.
But not much, yeah.
You were all brave.
Yeah, but Ruth, I mean, with her health, and she did a couple of trips, whew, yeah.
But you know, you're practicing after the earthquake. You're practicing battlefield medicine.
Oh, and you know what? And I loved it. I mean, it's working, and you don't think, you know, you act. And I had the students with me, and actually that's something I should have continued, like as a responder, because I loved it. But you were on a drive, and what really is when I saw children come in. There was a mother, I'll never forget that. She brought the kid is not even a year old, right? Limp. And we put the kid in one of the rooms, and that I remember that young female physician from one of the hospitals, I want to say Kentucky somewhere, some mission, and we tried every vein in that kid body. We wanted to give her fluids. Couldn't find any, because we thought maybe she had diarrhea, cholera, whatever. Couldn't find a thing. They finally did a cut down, I mean, little babies. And overnight, that kid made it. I said, this is God's miracle. Because we tried everything. And that young female doctor really did a good job.
Wow.
I don't remember who she is, but that was, I mean, we all worked on that kid. Worked, and God saved that kid. I hope that kid is still okay.
You're doing God's work.
Yeah.
I mean, why do you go back to Haiti over and over again?
I see the need. I can use my skills to do more. And that's what takes me back. What makes the story incredible, to find people over, like H&F people, to be willing to help all the time, putting their own life, their own money, people coming to help. Even with that master's program, we could not have done it if we didn't have people working out of their free will. So to see people volunteering and doing this, you say, oh, geez, there's a God out there, you know?